Hi everyone, welcome to our Friday 15 on reactive attachment disorder. I am Mallory Phillips. I am a licensed professional clinical counselor at Access Counseling Services, and I will be discussing this presentation with you today. What is reactive attachment disorder? Reactive attachment disorder, better known as RAD, is a condition in which an infant or young child does not form a secure, healthy emotional bond with his or her primary caretaker or caretakers. Children with reactive attachment disorder often have trouble managing their emotions. They struggle to form meaningful connections with other people. They also rarely seek or show signs of comfort and may seem also fearful of their caretakers, even in situations where their current parent figures seem to be quite loving and caring. These children are often irritable or sad and may report feeling unsafe and/or alone. Who is likely to be diagnosed with reactive attachment disorder? Reactive attachment disorder is most common among children between ages 9 months and 5 years who have experienced physical or emotional neglect or abuse. While not as common, older children can also have RAD, since reactive attachment disorder sometimes can be misdiagnosed as other behavioral or emotional difficulties. Children may be more likely to develop reactive attachment disorder if they meet some of these criteria: have had many different foster care providers or spent time in an orphanage, were taken away from their primary caregivers after forming a healthy bond, or have had multiple traumatic losses early in their lives. So let's talk about the different types of attachment styles. So there's only one healthy attachment, and that is the secure attachment. In a secure attachment, the caregiver tends to react quickly and positively to a child's needs, and the caregiver is responsive to the child's needs. Something like this might be if a child is crying, the parent may go over and see what is going on with them. Or if they're hungry, they get food. The child may exhibit behaviors such as being distressed when the caregiver leaves, being happy when a caregiver returns, and they may seek comfort from the caregiver when scared or sad. As you can see, in a secure attachment, the caregiver meets the needs of the child, and the child is more likely to go to the caregiver for help. Sometimes children don't have these secure attachments very early on, so they kind of struggle with things throughout their whole life. So an attachment style that is not secure, an example would be insecure avoidance. In a situation where there's an insecure and avoidant attachment, caregivers tend to be unresponsive or uncaring when a child may be crying or needs something, and they may often be dismissive. They may tell them to go away or just not meet their needs. So the child typically responds, they don't really care if the caregiver leaves. There's no distress associated with it. They don't acknowledge the return of the caregiver. Okay, they're back, doesn't mean anything to them. And they don't seek or make contact with the caregiver. So these kids may seem more independent, but they're actually avoidant of a caregiver or a parental figure. The second type of insecure attachment is insecure ambivalence. In this situation, a caregiver will respond to the child inconsistently. So sometimes their needs will be met, other times they might be more dismissive or unresponsive. As a result, the child typically feels distressed when the caregiver leaves, but is also not comforted when the caregiver returns. So they may be a little bit more emotional. They may cry more often. Their emotions may be bigger emotions when the caregiver leaves and when they return. It never eases. And lastly, there's insecure disorganized. So in this situation, the caregiver tends to be abusive or neglectful. They might scare the child as they respond in frightening or frightened ways. So this might be a child who was taken away by Children's Services because of an abusive caregiver. And then the child behaviors, no attaching behaviors. So you may find that these children have a hard time attaching to peers as well as potentially the adults in the school. and they are often appearing dazed, confused, or apprehensive in the presence of a caregiver. So you may see kids shy away from a caregiver who may be giving them a directive, or they may not be able to fully process what is happening because we're looking back at that abusive times when they were supposed to have that secure attachment, they did not obtain that. So their responses are going to be more delayed. So what are some symptoms of reactive attachment disorder that we may see? Symptoms of reactive attachment disorder may vary from child to child. Infants and young children who have reactive attachment disorder show common signs such as failure to show an expected range of emotions when interacting with others, failure to show emotions of conscience such as remorse, guilt, or regret. They may avoid eye contact or physical touch, or maybe both, especially with caregivers or anyone who will be taking care of them in general. They may express anger, have tantrums. They may be seen as irritable, unhappy, or sad. They may even show some opposition, disobedience, and arguing. Now, we know that argumentativeness and disobedience sometimes depend on a child's age, such as a teenager versus a 5-year-old. However, what we see in a situation like this is it goes beyond what would be considered usual for the child's age and situation. And then they may often display inappropriate affection towards strangers while demonstrating a lack of affection for or fear of their primary caregivers. So you may see a child not have any sort of relationship with their parent. There may be something that may have happened, a situation that may have happened where there's an insecure attachment early on in life. Working with the older ones, you may see that they struggle in their peer or romantic relationships. A lot of times these can be the end result of having insecure attachments in the beginning. So how does reactive attachment disorder affect a child over their lifespan? So typically as children grow older, their symptoms usually fall into one of two general patterns. There's inhibited reactive attachment disorder symptoms, and this typically happens when a child is aware of what happens around them, but they don't respond typically to outside stimuli. So they may be withdrawn or emotionally responsive. They may not show or seek attention or affection from caregivers or others, so they seem very isolated from others. They like to stay to themselves. And then there's disinhibited reactive attachment symptoms. Some people may know this as disinhibited social engagement disorder, and this is when children can be very friendly towards strangers. There may be a brand new person who comes into the room, and this child may sit on their lap, or this child may give them a hug. So they don't necessarily prefer their primary caregivers over other people. In most cases, these children who have been impacted by disinhibited reactive attachment disorder symptoms, they act younger than their age, and they may seek out affection from others in an unsafe way. So we always try to teach stranger danger, but if you have those people who are overly emotional, overly physical with people they don't know, this could then put them into danger. So how do we treat reactive attachment disorder? Treatment focuses on repairing or creating an emotionally healthy family bond. So we want to aim to strengthen the relationship between the children and their caregivers in a way that can later help the child to develop other healthy relationships. So you may see children in your school anywhere from first grade even through high school that they don't typically have a healthy relationship. Maybe they bounce from relationship to relationship. Maybe they stay in abusive relationships. Our goal is to help them to identify what a healthy relationship is and how to respond in a healthy way. So both children and parents tend to benefit from the tailored treatment plans for reactive attachment disorder. So it may include psychotherapy or counseling. So that's when a mental health provider will work with a child and their parents in a variety of ways, Sometimes one-on-one with the child, sometimes family therapy, sometimes just the caregivers, but ultimately it's used to build schools and reduce problematic behaviors at home or in society. Family therapy is another aspect, and this therapy works together with the primary caregivers and the child to develop ways to interact in healthy ways. So if there is any sort of abuse, verbal, physical, sexual going on, we want to try to address that and build better communication pathways and healthier relationships of how to manage the stressful situations happening with the child, as well as what the outcomes are, the results. There's social skills intervention. So this therapy teaches the child how to interact more appropriately with other similar aged children in typical social settings. So think about social skills training from the very beginning. We're teaching how to interact appropriately, not to yell, how to compromise. These are like our core emotional regulation things and how to get along with others. So typically the parents are also involved to help the child use the skills they learn. So if you're working with a child and you're teaching them specific social skills, you may want to let the parent know what you're working on so they can reinforce those things at home as well. At times there can be special education. So if the child qualifies, there are school-based programs that can help children learn the skills to succeed both academically and socially. And then lastly, there's parenting skills classes. And in these sessions, parents learn more effective ways of managing their child's challenges. So this can be really beneficial because managing the discipline for children with reactive attachment disorder can be more difficult. It can be very trying. You may even see this in your classroom where they may not listen. And you have to find the best way to intervene. So what complications are associated with reactive attachment disorder? Physical, emotional, and social neglect and abuse put children with reactive attachment disorder at higher risk for complications in later childhood and adolescence. These complications could include delays in developmental milestones, delays in physical growth, emotional problems such as depression, anxiety, and anger management issues, eating disorders, drug and alcohol abuse and dependency, trouble in school, whether trouble learning and retaining information, or behavioral issues. Maybe they're getting into arguments, maybe they're fighting. And then problems in relationships, not only with adults but also with peers, and potentially later with their partners. So what steps can we take to prevent reactive attachment disorder? The best way to prevent reactive attachment disorder is by ensuring children form healthy bonds with their parents or other primary caregivers. Healthy bonds form when caregivers promote family bonding through secure and consistent relationships, help children feel secure and loved, and support children through their phases of development. So what are some critical things teachers need to know about reactive attachment disorder? Number 1, kids with reactive attachment disorder manage their environments and the people in them to feel safe. So they often triangulate the adults in their lives. For them, it's a survival mechanism. The adults rarely realize it's happening because the kids with reactive attachment disorder are really, really good at triangulation. So teachers, therapists, and even other adults may feel at odds with the child's parents as a result. So maybe the kid tells you one thing, and then you say it to the parent, and the parent disagrees completely. The child will try to play each other against one another. Second, kids with reactive attachment disorder push away their primary caregivers, so those trying to get close to them emotionally. They often ostracize their primary caregivers from friends and family and may even falsely accuse parents of poor care. So if you have a child who's consistently coming in and reporting abuse, neglect, or how bad their parents are, this may be something to consider. And lastly, trauma during critical developmental stages hinders their brain development. So children who survive trauma at early ages aren't not given the chance to get through early developmental stages normally. Therefore, their brains are essentially stuck in the mindset of a toddler. So if you see a child or maybe adolescent acting at a very young age, this is something that may be considered. So what can teachers do to help children battling reactive attachment disorder? You want to keep discipline discreet to keep control of your classroom. So you want to hold these children who are diagnosed with reactive attachment disorder accountable for their actions, but don't do it in front of everyone. As we mentioned previously, kids with reactive attachment disorder do their best to manage their environments to feel in control and therefore feel safe. So if you bring attention to one of these children in a public setting, they may very well take the opportunity to take center stage and then take over your class. And then it just creates chaos. Secondly, try not to take the child's behaviors personally. So remember, kids with reactive attachment disorders use behaviors as self-protection and survival. These children are always in survival mode, so their behaviors can be extremely frustrating, overwhelming, and confusing. So do your best to remove yourself emotionally from their behaviors. I always ask myself, what may have happened to this child? What is happening right now? And then as a little self-talk, this isn't really about me. We just may be the ones who get yelled at or screamed at or things thrown at us. Remember your important role, which is to educate. Although tempting, don't attempt to solve or fix any of these kids who are suffering with reactive attachment disorder. Leave that to the therapist and the parents. The kids with reactive attachment disorder need you to focus on educating them, most of all. And then focus on natural consequences and structure, not behavior modification. So kids with reactive attachment disorder want and need for you to treat them the same as everyone else. This may be the only opportunity when they get that. They thrive on routine, consistent expectations and accountability, and logical consequences. So behavior modification systems present another way for kids with reactive attachment disorder to control their surroundings. They may look like they're doing well, but they probably aren't making any real progress with behavior management systems. You want to hold kids with reactive attachment disorder accountable for their own learning and choices, not their parents. So parents can often provide children with quiet and sufficient learning spaces, time to complete homework, and their availability to answer questions if needed. The rest should be left up to the child. So allow kids to have the gift of responsibility and opportunities to build their self-esteem. We don't want to say, well, the parent's not doing this right. Well, what can the child do to change these? And then you want to work alongside the parents. Parents of kids with reactive attachment disorder often get mistaken as bad parents. They're either too lenient, too strict, or they're uncaring. So these are a lot of the common misconceptions that stem from the complicated nature of reactive attachment disorder. So you want to trust and listen closely to the parents, because typically the primary caregivers will know a little bit more about reactive attachment disorder than you do, because they live with it every day. So one main takeaway is that it takes a village to raise a child. So it's not just the primary caregivers who need to be doing all the work. The relationship that you have with a child in a school setting can make the world of a difference. If you have any questions, please feel free to reach out to me at the email below, or you can ask any of your access counselors on staff at your school, and they'll be more than happy to answer your questions. Thank you for attending and have a great day.